Well, you might wonder who would want elective surgery right in the middle of a pandemic. Well, it turns out a lot of people.
Right, so staying home has been a lot of downtime without having to use those vacation days. People are now saving on commuting costs and work wardrobes, and all of those Zoom calls have given people plenty of time to analyze the lines and wrinkles, the imperfections on their face and neck, etc.
All right, so no surprise, cosmetic procedures, they are on the rise. And Dr. Christopher Johnson is a board-certified cosmetic surgeon, and he joins us now with the do's and don'ts of plastic surgery. Good morning to you, Dr. Johnson. Great to have you.
Good morning. It's a pleasure to be with you this morning.
Great. So we, like everybody else, we've been glued to our screens, watching all those, glamorous celebrities looking all so perfect. So what's been the impact on your profession?
Well, the pandemic has really created a surge in plastic surgery. We've seen a boom in the procedures and a sort of a shift in the types of procedures that people want. It's really been quite amazing. And you hit on the main points. A lot of people are at home. They are going to work on Zoom so they can recover and still work. They have cash that they received from the government in the form of stimulus checks. So they have a little bit more cash on hand. And so it was a perfect greenhouse effect for making people able and willing to have plastic surgery.
All right, so what are the procedures that are most in demand right now? Because we talk a lot about, celebrities and seeing them, but they have makeup artists, they have good lighting, they have filters. What are you seeing in your office? What are people asking for?
Well, and the thing is, celebrities drive it, but more importantly, social media is driving what women and men want. There's a silhouette that Cardi B or Nicki Minaj silhouette, small waist, large hips, and buttocks. So what we're seeing in the office is lots of liposuction, lots of fat transfer or Brazilian butt lift to the butt and fat transfer to the hips. Those are the biggest ones, and we can't do it fast enough for these ladies.
Oh my goodness. So, with any kind of surgery, especially plastic surgery, there are risks associated with them. So you mentioned the Brazilian butt lift and the lipo. Are there procedures that you would not recommend?
I think it's. I think the real issue is, there's a whole pantheon of plastic surgery procedures that we know are relatively safe and in the right hands. That means a board-certified plastic surgeon. I also don't recommend that people go outside the country for plastic surgery. I presently have a number of patients who went to Dominican Republic and to Colombia and have terrible complications, and it's very hard to recover from that in a way that's acceptable for the patients. So choosing a good board-certified plastic surgeon, really choosing the right place. The great thing about the pandemic is people have stayed close to home. And that's really important, because if you have a complication, you can go back to the doctor who did the surgery, and they have a professional and a moral obligation to make things right.
All right, let's talk about how expensive this can be, because this is cosmetic and insurance says you don't need it, so we're not paying.
No, so your insurance doesn't care if you look more beautiful. so it only matters to you. And the great thing is that people are looking for a discount, but be careful. You may get what you pay for. The typical liposuction BBL case, you can find it, especially if you go to certain sort of mass production clinics in Miami for $5,000, right? But again, it's going to be like an assembly line. It's going to be like a factory. I think that you should expect to pay for a lipo BBL somewhere in the neighborhood of $8,000 or $9,000, and I think you'll find that you'll get really personalized treatment and that your outcome would be better.
And now let's talk about the recovery time, because, what can you and can you not do in the weeks after surgery? I mean, for example, with the Brazilian butt lift, can you sit down? I mean, how do you sleep?
Well, you sleep on your sides, but of course, if you get fat transferred to your sides, then you basically have to turn every hour. There's a special pillow, a donut-like pillow that we give the patients so that while they're sitting for their Zoom meetings and things, that they decrease the pressure. It turns out that you can pretty much sit as you normally would, as long as you don't stay in the same position for more than an hour. Is it painful? No, it's not particularly painful post-op. The thing that I think that I'd like to really focus on with you, could you ask a really brilliant question? What about post-op? I think so many people come to us as plastic surgeons and they expect to have surgery and then it's over. But in fact, it's equally important how you take care of yourself after surgery. That means giving yourself time to recover. So not rushing back to work and the stress of children and all those things. So you have to prepare so that you're looked after and you're cared for, and that you can recover, that you can decrease the stress that you have in your life, because your body is trying to heal. The other thing is to eat right. Obviously, what does it make sense to have liposuction and spend thousands of dollars and then not eat properly? And so really having a great result requires patients to do their part, which is to participate actively in their recovery by eating right, minimizing stress, and giving themselves time to recover. The other part of liposuction and BBL is having regular massages after surgery. Massages decrease scarring, decrease swelling, makes you feel better and heal faster. So we recommend in our practice at least 2 massages per week for 6 weeks after surgery.
All right. Okay. Last question for you before we run out of time. This is not just women out here trying to look their very best. Men also are getting procedures. What are they demanding?
Well, the big ones for men are in the pandemic are liposuction, rhinoplasty. Those are the big ones. We do have some men who want fat transfer to their buttocks, not as much, but we do have that. But it's liposuction and particularly lipo etching to bring out the 6-pack. They want that, and everybody wants to look like one of those celebrities on television with a beautiful 6-pack.
They're either heading to the gym or to the beach, I think.
Yeah.
Exactly.
Wow.
Either way, you don't have very much clothes on, right?
So great information. Dr. Christopher L. Johnson, board certified cosmetic surgeon. Very important. Thanks so much for joining us with all of your thoughts.
All right. Coming up.